Hello all, this is your short video to support you with doing postnatal care in the community on your laptops. As per my email that I sent out a couple of days ago, there are a number of ways that you can record your care in the community. You can work offline in offline mode. You can tether to your phone in the person's house and then work on live mode. Or you can work on their Wi-Fi with their consent. Plenty of you to get started might want to just work offline, and that's absolutely acceptable. So I'm going to talk you through that. I can't do this on the offline cloud because I need internet to be able to record. So I'm doing this in the training cloud. You can see here at the bottom in a pinky purpley colour, it says training. You'll know when you're in offline mode because it will say offline in blue down here. So when you get your visits through for the day, you will then want to go to offline usage menu once you've logged in. I haven't added myself as a user on this device to the training cloud in the offline mode, so we can go through that together. I'm going to click OK to add a user and then click Add User. Again, I'm using the training cloud login. You would use your actual live login to log into the offline menu and to add yourself as a user. As you can see now, I've been added as an offline user to this particular device in the training cloud. To add the people that I'm going to be visiting today, I'm going to click Offline Patients, and then I'm going to click Add Patient because I'm going to add them individually. I know the 8 people I might be visiting today, so I'm going to add those individually. If I was working for a team specific, I could then add the whole of that caseloads team, and that's probably what I would do every morning. I would upload and download the everybody's care records so that I could work offline because I might not know who I'm going to that day. Again, if you're doing a home birth shift, then you may decide to download everybody over 36 weeks gestation who haven't given birth. This is a work in progress, and it may be that we adapt this process. But for now, to add individual patients, I'm going to click Add Patient. I'm going to select all open episodes, and I'm going to type in Poppy, which are the people on our training cloud. You automatically get Poppy's name and details. You get the booking date, agreed EDD, gestation, and then finally the date they've given birth. So I'm going to select this particular Poppy who gave birth on the 14th, and I'm going to double click her record. And as you can see now, in my offline patients, I've now got Poppy 7 ready to record postnatal care. You can see I've got a circle here, green circle with a white tick. That means that her cloud and the documents on her cloud is all up to date. If I do any care at somebody's house offline, when you will then see this as a red circle with an exclamation mark in. You haven't done anything wrong. It's just telling you that you've got to upload the data that you've inputted to the cloud when you reconnect to Wi-Fi. You have 2 options for that. You can come back to the hospital and use the hospital Wi-Fi. You can tether to your phone, or you can use your home Wi-Fi. Any of those will be absolutely fine to resync the record and the care episodes that you've documented on. I'm going to click Done. That would mean that following that, all of the people that you've downloaded into your offline usage, you will be able to complete care for in the offline mode at home. I'm now going to click Women Lists, and I'm going to find Poppy. Again, if I was working offline, I wouldn't get all of these Poppies. I would just get the one that I had downloaded on the offline mode. Oops, and that was the wrong one. And this one. So we have now got a Poppy. I can see that she's given birth. This is her pregnancy summary. I've got her booking history, obstetric history, and I've got her labour and birth. So what I might want to do before I go in the home is just have a review of the labour and birth, have a look through that and see exactly what happened. during delivery. You can see she had a spontaneous cephalic baby, and hopefully, obviously, all of this information would be completed. She's had a low EBL, and she went into labour spontaneously. She had an instrumental birth with meconium aspiration, and as a result of that, baby has been reluctant to feed, and we've got a bit of a feeding plan here. Don't forget, this is our training cloud, so this is old information that people have inputted for the sake of training. What I'm first going to go to is just draw your attention to the baby 1 tab down here. So normally, if this person was pregnant, that would just be reports, it would start here. But now she's given birth, we've got a baby 1 tab. And if we go into postnatal, we can see all of the postnatal care that has happened to this person during their stay in hospital or during their caring community. If I click on summary of care under baby 1, again, you get those nice, easy to read episodes with information on and postnatal checks that have happened. I just want to draw your attention also, an important bit of information is that the notes bit part at the end is where you can put any really pertinent information that's happened during your visit that you want the next person to see quite easily. So they then haven't got to go in and open your previous note to see exactly what's been written. You can add an additional note at the end of the assessment, which will show here, and that's the same for baby. You'll have a notes tab at the end, which you'll be able to see any pertinent information really, really quickly. So click on my postnatal tab. I'm in the house. I know what birth she's had. I checked that when I was outside, or if you want to wait until you're inside. I am now going to do a postnatal check and postnatal assessment on somebody. So I'm going to click on my red cross, select postnatal assessment, and I'm just going to work my way through the admin data. So why I'm here, it's a face-to-face visit. I'm at home. The mum's available. The reason I'm here is for a mum and a baby check, and it's me carrying it out. And I've got consent for procedures, and the partner is available at home as well with me. This is the end of assessment, so I'm not going to do that yet because there's a couple of forms that I need to open and complete for their assessment. I've done my admin part. I'm now going to scroll down until I find some links to other forms. So the first thing you've got is mother links to forms, and underneath that you've got baby links to forms. What I'm going to do is first of all do some observations on my mum. So consent is contained. Again, I'm at the mother's home and it's me completing. She looks well today, however, she looks a bit weepy and anxious. I'm not carrying out urinalysis, and just as a side note, these forms are exactly the same forms as what they would use in the hospital. So these are generic postnatal assessment forms. Just because it says vital signs, it doesn't mean you need to start doing her oxygen saturations and her respirations at home. It's not relevant. We skip past that. We skip past the critical, the meows, we skip past sepsis until we get to our postnatal, regular postnatal assessment. Her breasts are fine today. Her nipples are sore actually. And I want to make another comment about that. So I'm clicking other and I'm going to write using Lansano. Advice given, and that will save the 2 comments, so they're sore and what I've recommended for that. Her uterus is firm and well contracted, and I'm not expecting her perineum today, and I'm not going to write a reason because it's not something that we would have routinely done today. Her lochia is average and it's dark red. She's got no problems weeing and no problems with her bowels. Pelvic floor, we're discussing that, and we've discussed exercises. Her legs are absolutely fine, no abnormalities, and she's in a little bit of abdominal pain. She's having some after pains. And I've advised her about that. I'm not going to comment on her appetite, but I might on her sleep. It's poor. Any additional observations? So weepy today, discussed hormonal changes to be expected, advised partner what to look out for. As SOS numbers. So yes, I'm going to publish this to her mat notes so that she can see the observations we have done today. And I'm going to save and close mums, the observations of the women. If you look here at the top, you know you're on women's. So observations, I'm going to save and close that part. It takes me then back to my postnatal assessment. I'm not going to do the end of the assessment because now I want to do my baby form. So I'm going to scroll down here until I find links to baby forms. Just as a side note, if you were doing any postnatal blood tests currently, or if you're taking an MSU, you would then click on this tab and report and record that you've taken an MSU today. So all of the links, all of the extra care that you might need to do in the postnatal period should be under the forms that link to mother. If you want to discuss a little bit about postnatal conversations that you're having, then you can click on that, and this has already been filled in because this is a training one, but you could then add some additional notes regarding your postnatal conversations. So I'm now going to click on the baby form, and we're going to do a daily examination of the baby. The baby's been examined by me, and the ID check is not appropriate because we're in the hospital, in the community. So general condition appears well. Baby under observations, no. We're not doing temperature, heart rate or respiration rate, and we're not measuring baby today. If we've weighed baby today, we click yes, and we put in the new weight. Now, this baby hasn't got a birth weight, so I currently can't do that. No, sorry. So currently can't do, I'm not going to input a weight. Actually, I will input a weight. Poor baby's got no birth weight. So put it in as grams, and it's going to convert that to pound for me. I'm not doing SATs today, but what I am going to do after I've done my check of the baby, I'm going to mark all as normal, and I'm going to say yes. And then actually, I've noticed that the baby's looking a bit jaundiced, so I'm going to switch the colour to jaundice. And it's just advising me that the baby might need a TCB, which obviously we would continue to do. It then asks you for a bit more information about the jaundice. So it's mild today, it's mostly on the baby's trunk, and I'm not sure if it's worsening or improving because it's the first time I've noticed it, so it's static. I've discussed the neonatal jaundice with mum and dad and parents. So because I've selected all to normal, it does put them all to normal. It saves you a little bit of time, and you can then just go back and amend the one as needed. I'm not checking the baby's reflexes today. The cord is, clamp is on, and it's clean and dry. And the baby has passed urine today, and we've had 3 wet nappies. The baby's passed stools, and it's a changing stool now, and we've had 4 lots of stools. If you wanted to comment on your baby's urine or bowel movements, then you would put that here. If you wanted to do any referrals, if any referrals were required, you could document them here, but this isn't actually doing the referral itself. So if we needed community feeding support, I could click on that. Is the baby fit for discharge? No, we're not at the discharge appointment. BCG required? No. If you wanted something to appear in the baby's comments, the same way as we looked at the parents, at the mums, we would then put the comments in here. So I'm going to put feeding well, discussed, called care. And again, you might not want to put anything in the comments, but you've already documented that everything's completely normal at the top. So I'm going to save and close this. I've now documented my mum and my baby check. If we go back down to the links to babies, we then might want to do a feeding assessment or a feeding update on baby. So I'm going to click feeding update, date type, and this might be my 3rd day assessment today. So we've gone through a bit about positioning and attachment. Has a discussion taken place about mother's concern and support offered? Yes. So baby has already been documented as being reluctant to feed. At this point, you can record your frenulotomy assessment. You can do your breastfeeding observation checklist, which is going to remind you of all of those procedures and what we should go through when we're discussing exactly how baby should be feeding at the breast. I'm not going to do a latch assessment because it's already been done. And then I could click on my baby feeding plan. And this is where I would document what I'm doing. So baby is reluctant to feed, issues identified, maybe traumatic birth, slow to feed. Responsive feeding discussed. What our plan is that we are going to stimulate baby, offer baby breast, and then we're going to express post feed. Maybe not latched. Not. We are going to offer EBM. So I'll leave that there because I know, as you know, we could go on quite considerably in there. Talk to you a bit about, so I'm going to copy this, ready to put over into Mum's notes to be able to publish it to her maternity notes portal so she can recheck and reread the feeding plan at any time. I'm going to save and close that. And again, you've got the feeding assessment and your frenulotomy here. There seems to be lots of different places that you can record this. Again, it's a learning curve. We're all learning together about what needs to go where. The most important thing is that we get the information on there ready for the next person who's going in. Okay. So this is, so I've now done the mum and baby check, I've done the feeding assessment, I copied the feeding plan, and I am now going to say that we have ended this assessment. So I put a T in for today, use current user, and just wonder if this is postnatal. If you then click on the update personal care plan, you then get a postnatal pathway, which is new, that wasn't there antenatally. So you've got pathway events. These are all of the information that she will get in the first week of birth. If you want to add any additional leaflets, such as how to make up formula safely or anything like that, click on that, find the leaflet you want and add it. You can also send a push notification for that week. I don't think we're going to be doing that. So this is where you can send any additional reading that she might need. Okay, and it wants you to authorize. I'm going to save and close that. So has the blood spot screening taken? Not applicable because it's not the right day. System notes. Yes, she's got access to the notes. And if you wanted to add any additional comments on leaving, it would be here. So I'm going to save and close this postnatal assessment. As you can see, I've now got a postnatal assessment that's come on today. It's got the parts of the comments that I put is on there. If the comments are really long and you can't see the end, you click on this, you then go to observations, and the comments in full will be down at the bottom here in the additional information. If I go on to baby one, summary care, again, I've got today's assessment, and I've got everything that has happened today. And the same thing, if you wanted to see everything that happened, you click on that, and baby examination. If you wanted to see the notes that were at the bottom, if you couldn't see them in full, they will be here on the right hand side. The feeding plan is on the summary of care. As the feeding plan changes, the current feeding plan will be on the baby notes. So again, to access that, you click on the appointment, yesterday's appointment, if you're going in the next day, and the screen will swipe left and you will get the feeding plan here. So that is the postnatal care for this assessment. I'm just aware that we have, what I didn't do was document and send mum the postnatal feeding plan. So I'm going to open my observations tab. I'm going to click back into my observations tab to edit it. And in the additional notes at the bottom, where I've got weepy today, discuss hormonal changes, I'm going to just enter down, and I'm going to paste in my feeding plan. So this will now go onto mum's app so that she can access the feeding plan, and save and close, and that will update on her app. So that is postnatal care in a nutshell. If you wanted to do a referral to baby, so you type in referral, and now we've got a baby here, we can now send off a referral for the baby. And at the moment, we haven't got, we've got a referral to the breastfeeding specialist team that you can do via Badgernet. We've got the prolonged jaundice referral that you can do via Badgernet as well. So those two referrals are on there. More will be added in time, but currently that's what we've started with. So I think that's it. If you've got any comments, or add it in the comments below on Workplace. I'm also going to try and email this video out, because I know not everybody accesses Workplace. So hopefully that will help. We are planning to be around for when we go live. So don't forget, as long as you've got the Teams chat on your work phone, you'll be able to add a comment onto the chat at any point if you want any support. Otherwise, myself, Steph Moss, Alana Dunkerton will all be around to support you. And as the other team leaders become more and more au fait with the system, they'll be there to support you too. Good luck, guys, and thank you very much for listening.